I am from the group as Clipchamp. I and my team have discovered that there is a lack of access to healthcare services in South Africa. Healthcare inequalities, lack of access to quality and healthcare services. We have discovered that majority of population relies on public sector that faces challenges of overcrowding of facility, a shortage of healthcare professionals. Healthcare inequality create a reality where marginalized communities encounter a greater barrier in accessing quality, affordable healthcare services. We also have compiled statistics and stories of people who are encountering this problem. Here is Elizabeth. Elizabeth is a young woman residing in Soweto, Johannesburg. She has a bachelor degree in accounting. She comes from a low-income background. She lives with a family. She enjoys styling hair and watching news to stay up to date on current events. She has been recently diagnosed with a chronic disease requiring a regular checkup. So she encountered a problem when she goes to these public facilities to access the healthcare services. Problems such as long queues, unequal access to healthcare. The approximately 50 million South African can only access underfunded, overcrowded public health system. 8 million on medical aid coverage can access a well-resourced private sector healthcare services in facility. One doctor sees 2,457 people, while a ratio of doctors to people on medical aid scheme is 1 into 429. Geographical effect on healthcare access. Considerable disparities in healthcare access and outcomes in rural areas and informal settlement compared to urban areas due to lack of infrastructure, shortage of healthcare professionals, transportation and distance. Healthcare services. These factors contribute to disparities in healthcare access and utilized across communities. Factors such as quality of services, availability of resources, affordability, and professional of staff. Our team and I have had an idea to develop an app. We have already developed the wireframes. We have an idea to create an app where there is a virtual consultation. Patients don't have to travel to access healthcare services. They can do this at the comfort of their home. Our app is going to feature such as medical chat AI. If you have some sicknesses but you're not going to a doctor, you can do a medical chat AI. Virtual consultation, medical reviews, electronic health record, and it's also going to provide delivery and collections of medicine data. This is the reason we're doing this is to increase access to healthcare services, expand the reach, affordability, and timely interventions. This is our wireframe. It's not complete, but it's a picture of our wireframe. This is our users' needs. They need access to healthcare services regardless of the geographical location, a way to afford healthcare services, access to mental health care, access to chronic disease management. Recommendation. There are some certain things that can prevent our users to access our app, but we decided to create an app where there is going to be an offline functionality. Enhanced app functionality is lower. Security question to access healthcare records and profiles. Language options help AI. Steps. Our next step is to refine the concept of the app, build a team including developers, develop a project plan, develop